Rachel. It's so nice to
Hi,
see you.
Lindsay. It's great to see you too.
So, we actually know each other in real life. We met in our co-working space in Burlington at Hula in Burlington, Vermont. And so we met because I would say that we are just two social butterflies.
Yes, this is true. And we have the same preference for around where we sit in the co-working space.
This is true. Also true. So, I'm so honored and thrilled to have you on today.
Thank you.
Okay, there's so many different angles that we could take this topic, and I know it's something that touches the lives of so many of us in different ways. And there's also three areas I'd like us to explore together.
Great.
And firstly, that is cognition and alcohol's impact on it. Secondly, the relationship between alcohol and dementia. And thirdly, the role of alcohol in caregiving. But before we dive into that, why don't you tell us a little bit about you and your work?
Sure, happy to do that. And I could talk forever about this, so I'm going to try to keep it succinct. But my work has been in occupational therapy. So I'm an occupational therapist with a niche in dementia care. So I've been working with older adults in some capacity since I was a teenager. I used to work in a nursing home as a teen. And then, really have always been drawn to working with older adults in some capacity. And then from a personal standpoint, my grandmother and both of her sisters ended up diagnosed with some form of dementia. So I really saw firsthand what caregiving looked like. My mom ended up actually being the primary caregiver for my great aunt, and that kind of happened overnight. It was just kind of put in her lap, like, your great uncle died, you're next of kin. She has moderate dementia. Good luck. So that was kind of fuel to my fire to see, like, wow, this is really hard. And the healthcare system is not really meeting a lot of the needs. So it was the fuel to my fire to say, hey, there's a massive gap in healthcare and I want to try to fill it. So I used to have a patient care practice in the Philadelphia region where I provided direct patient care to individuals living with dementia and their families. I think at any given time, we maybe had like 4 or 5 of us working as OTs in this field. We did all of our work as outpatient in the home model, so a Medicare Part B model. Medicare reimbursement keeps getting cut, so it made it really hard to financially sustain the practice. So ended up transitioning to more of a consulting model. So I do more coaching and consulting with family caregivers these days. But that and a little bit of training of other healthcare professionals, again, to try to hopefully fill the gap in the healthcare understanding of dementia care.
The work you do is incredibly important.
Thanks.
And like, where to begin to navigate these things when you are all of a sudden finding yourself with a family member who needs this care is completely overwhelming. And so that's part of what we're going to talk about today is also the caregiver and the stress that they're under and alcohol. But before we dive in, I find that it's helpful to align on some definitions when we have sciencey technical conversations specifically. So let's say that, let's see. There's a few things that we're going to be talking about throughout the episode. And would you define the following terms before? Let's start with cognition.
Great. I'm just going to keep it simple and say cognition is thinking.
Perfect. We all know what that means.
Yep.
Cognitive impairment.
Yeah. Cognitive impairment would be a thinking impairment or a thinking disorder. So anything that impacts our ability to think clearly.
I think that my audience knows where we're going with this. And then lastly, dementia.
Yeah. So dementia, and I'm going to add Alzheimer's to this as well, just because I think sometimes people get those terms mixed up, which is understandable because oftentimes in the medical world, and I'm guilty of this myself, we use them sometimes interchangeably, which isn't great. Dementia is a syndrome. So it's technically a group of symptoms. So the way that I often look at it is like, if we think about cold symptoms, like you might have like a runny nose and a sore throat and achy ears, and there's a bunch of different things, and we lump it together, and we're going to say it's like a syndrome, but it could be caused by a lot of different things. So it could be a cold, could be caused by the flu, it could be COVID. Like, there's lots of different things that could cause that group of symptoms. Alzheimer's disease is one of the causes of dementia. So if dementia is this group of symptoms that is impaired short-term memory, it's difficulty with speech, it's changes in behavior and mood and personality, we lump it all together, we call it dementia. But again, there's lots of different things that cause dementia. So Alzheimer's disease is the most common cause of or type of dementia, but there are lots of different types of dementia. Does that make sense?
It does. It does. I can see the complexities there and why they're used interchangeably.
Yeah. It makes it really tricky because Alzheimer's disease, again, being the most common cause of or type of dementia, it's the one that we talk about most often and gets the most attention. So oftentimes, instead of saying dementia, people say Alzheimer's. But there are lots of different other types of dementia.
That makes sense. And we're going to get into those. So, but before we dive into the first two, impairment and dementia, what does healthy cognitive function look like? Like, how would you describe it?
So I think I'm going to start here by thinking about like what do we need for brain health? What are our brain health pillars, if you will? So sometimes you'll hear 5 pillars of brain health. Sometimes you'll hear 6. There's a lot of, there's complete overlap in the 5 and 6. So I'll give you some of those. So if we think about what do we need to have a healthy brain? One is socialization, which we've established, you and I, we've got social butterflies. Check. We've got one box. So socialization with other people is a really important part of having a healthy brain. Another factor of brain health is what we call cognitively stimulating activity, which again, cognitive being thinking, things that stimulate your thinking. There are lots of things that can fall into this category. It could be things like reading a book. It could be playing an instrument, learning a language, even things like driving home a different way from work and changing up your routine. These are all things that just like challenge our thinking a little bit more. And that would be if we're not using GPS, where we're thinking a little bit harder or differently about something. So cognitively stimulating activity is one bucket of brain health.
I love this topic. I love so much, or at least this pillar. We're calling them pillars, right?
Yes.
Because it's actually something that I teach in my coaching program. Because like our brains are lazy. We think what we thought yesterday. Like they're wired for efficiency. And so part of the process that I bring women through is we have to like interrupt the autopilot. And so one of the things that I often say is like drive home a different way from work. Not
same page. I love this.
Like, and not just so that you don't drive by the store that you always buy wine at, but also to make you have to focus on something and not just like how many times do you get home from work and you're like, you don't even remember the drive. Like that happens to me a lot. And so just taking one left turn, like go one extra cul-de-sac or something. And then the other thing that we create for the women inside my program is like just different things to do to relax, because while you are saying stimulate the mind, I also see that as a way to relax, as an escape from like your stress and your worries. And so this might look like painting or reading or doing a puzzle. My husband and I are big puzzle doers.
I love a jigsaw puzzle.
So like all of those things, this is just so interesting. Okay.
Yeah. And I mean, I could nerd out in 10 different directions from what you just said. So I'm going to try to rein it in. But one is the overlap with my profession as an occupational therapist. Everything you just said, we also consider those to be meaningful occupations. So occupations being things that occupy your time, and how as humans, that's what drives us. Like we want to have meaningful, valuable occupations. And that can be things like painting, reading, but it also is having autonomy over basic occupations. We want to be able to dress ourselves, feed ourselves, bathe ourselves, which are also occupations. So there's so much overlap in all of this and importance in all of these things. And another nerd out, you were talking about routine, and it makes me think about there's something called procedural memory. It's like our muscle memory.
Yeah.
And our brains do default to that. And there are, in terms of the dementia space, there are pros and cons to that, which I can talk about later. But what you're describing is when we tap into our procedural memory or our muscle memory, and we're not using these other types of more of our higher level thinking processes that our brain is capable of. So really, pushing our brains to use our executive functions to think a little harder or differently helps us get out of that procedural memory space.
Exactly, which is exactly what it takes for behavioral change to quit drinking. Like when we want to develop new muscle memory to where drinking isn't our normal reaction or the thing we do every day, it's like we have to repeat the new activities, the new habit, the new, like, so we're building our new procedural brain is what I'm hearing.
Yeah, that's it. Creating new patterns and new routines is really not the easiest thing to do, as I'm sure you and your listeners know. So I give everyone a lot of credit because it's really important and difficult, but it's also really crucial. It's also tricky because when it comes to dementia care, for better or worse, we default to those procedural memory patterns.
Yeah.
So if you're someone who is embedding drinking into your routine, and that's part of your procedural memory, that will be your default behavior, even if you have dementia. So adjusting these routines and behaviors when you have a healthier brain is really important in allowing someone to function at their highest potential, even if they do get dementia.
Oh my gosh, that makes a lot of sense.
Okay.
This is so good. Okay, what's the next
sorry,
pillar?
I was going to say back to pillars. Okay, so
perfect.
What did I say? Oh, social activity was the first one. Cognitively stimulating activity, I'm saying, was another one. You already touched on this, but rest and sleep. It's important for us to have rest and sleep, and rest can look different for different people, but sleep is really important for our brains to function at their highest potential. So those are 3 of our pillars. Another one is physical activity. So cardiovascular exercise is important for our brains. And then the last of the 5 pillars is a heart healthy diet. So we usually say what's heart healthy is brain healthy. And then that 6th pillar, if you use a 6-pillar model, is just like overall general good physical health. So not smoking, not drinking, those types of things would fall under that 6th additional pillar in some models.
I love this because also alcohol touches every single one of these. And so I'm going to try to just do a little recap. And if I forget one of your pillars, just help me out. But I'm going to start with, so we did the first 2, the third one being sleep. We already know that alcohol doesn't help you fall asleep. It makes you pass out. And then you wake up and it interrupts your REM cycles. And so you only really get disrupted sleep. So that's a big red X on alcohol, on that pillar with alcohol. What was the next one?
Cardiovascular activity or physical activity?
Yeah. So in general, cardiovascular activity, any type of physical activity. I'll give I was a runner example on this. And this is actually like how I lived was I really loved exercise and wellness and living a healthy lifestyle. So it also touches diet too, which is the other one. But my drinking habit caused me to bail on workouts with my friends. You know, instead of making my smoothie, I was hitting the McDonald's drive-through and drinking Diet Coke all day and caffeine and then feeling like garbage. And so the use of alcohol touches every single pillar that you are describing because even just the impact of alcohol in our bodies, it makes us not want to eat healthy. It makes us not want to exercise. And even if we are still doing those things, we're even more depleted. There were times where I used to go running as like my punishment for drinking too much the night before, and I would feel even worse after.
I believe that. Yeah, it's
So,
like the smaller amount of energy that you had, you used on exercising, which while exercising's good, then you were totally wiped for the rest of the day.
right, because
Yeah.
I started with an empty tank.
Yeah.
Like,
Yeah. Yeah.
so, oh,
It's really tricky. Yeah.
this is so good. I feel like our conversation's going in a little bit different direction than
I
we
know,
thought, but
I could talk about all these
I'm
things
here for
forever.
it.
So
I love it. I love it. Okay. So, oh gosh, where are we? Before we
we're
dive
good.
into
I was going to say,
impairment.
I don't want to derail us
No,
from
you're
our
good.
established
Okay.
routine, but I can also talk about some of the longer term impacts if that's, unless we want to talk about something else. You tell me.
Well, we're gonna get to those. So,
Okay,
okay.
fine.
So now we really understand now what cognitive function looks like.
Perfect.
And knowledge is power is something I always say. I always say that information does not create transformation,
Mm-hmm.
and we have to take action. So,
Yeah.
what is something, based on everything you just told us about the pillars,
Yeah.
or maybe those are the things that we can be doing in our daily lives to support this healthy cognitive function?
Yeah, I would say that that is the answer. So anything we can do to increase our engagement in any of those pillars. And again, I say that recognizing that that's not the easiest if you're not doing those things to just start doing them overnight. So going back to what you were talking about of, I think you should be an OT, Lindsay, creating new patterns and routines. We also, I don't know if you've heard of the concept of like behavioral activation,
Yes.
which, yeah, that's right up our alley in terms of starting new habits and routines. So starting small so that you can be successful, not setting these like huge lofty goals for yourself where if you can't do it tomorrow, then you're going to feel bad and then you're not going to want to do it. Set these tiny little manageable and achievable goals so that you can do it. You get the rush of like, woohoo, got my goal. And then you can keep building on that. So I think anything you can use from those concepts to apply to any of the pillars where you need some improvement is the way
I
to
love
go.
that. I love that. Something I learned, one of my clients taught me this saying recently, and it was all or something. And it's like, you
I
don't
love
just
that.
like, I always tell people, like, you don't just sign up to work with me and then you never drink again. Like, we are going to get you there,
Mm-hmm,
but it's
mm-hmm.
not like, there's no perfection around this. Like,
Right.
if you're currently waking up at 7 a.m., I don't have you waking up at 5 a.m. and running 5 miles, and that, like, we
Right,
don't do it that
right.
way.
It's just not realistic. Yeah. And
No, you're going to
I say
quit.
all of these things, I do like educational events about brain health and things like this all over. And I try to make sure I recognize for the audience I speak to, I don't have all of these things perfectly. Like I work solely in the dementia space. I know what the risks are, and yet my lifestyle is not perfect. We do the best we can under the circumstances, and we try to make these small improvements in certain areas where we are able to. And again, setting realistic goals for ourselves because too lofty and that's going to
Yeah.
be more
Yeah.
challenging.
They have to be easy enough so that we still want to do them when nobody
Yeah.
else is watching.
Yes.
When no-
Yes. Yes. I love that.
So, okay, the women inside my coaching programs
Yeah.
and probably listening here are midlife women. And how does aging impact our cognitive function? And are there differences in how this presents between men and women, actually?
Yeah. So, in terms of aging impacting our cognition, so we do know that there are age-related brain changes. Those are normal changes. So it's normal that when we get older, that our brains do think a little slower. That's typical and normal and to be expected. That means that like it's okay as we get older or even when we're younger if we have blanks in like I forgot this person's name for a moment, or just little things like where did I put the keys, and then like you take a minute and you're like, oh right, okay, they're over here. These are normal. That's what happens with our brain. The difference between age related changes in our brain, normal aging, and something like a dementia is when these things start impacting function. So meaning this is like a more extreme example, but like, okay, I can't recall the word key when I see a key. Yes, I'm blanking, my brain's blanking. That's it happens. But if I forget how to use a key or what a key is for, that's a sign that there's a more significant challenge or um, medical condition happening than just typical age related changes.
Right.
I can't speak too much in detail about the differences between men and women and aging, except I can say that we know that menopause does have an impact on our brains. Again, I'm not an expert in that space, so I won't talk too much about that. But just like we know how it can, again, impact sleep, and there are lots of different areas of our lives, that get touched by that. The other kind of component to keep in mind here as well is that women typically live longer than men, meaning that the rate of dementias is higher in women. So
Yeah.
dementia does increase in prevalence as someone gets older. So again, I just said I wasn't going to flip flop between the term dementia and Alzheimer's, but here I go again because our statistics are better for Alzheimer's disease, as in at least compared to all dementias. But the stats right now for Alzheimer's are that 1 in 9 people 65 years and older have Alzheimer's disease. That's a lot of people. And 1 in 3 people 85 years and older have Alzheimer's disease. And that doesn't touch on all of the other types of dementia. So again, the rate increases with age.
Sure.
I hope that kind of answers your question. Sorry, that was a ramble.
Yeah, absolutely. I'd love to understand. Okay. I'd love to understand the current academic discussion around the impact of alcohol use and dementia. Like, what does the research that you've seen tell us?
Yeah. So most of the research that I spend time in is related to the long-term impact of alcohol use and potentially overconsumption of alcohol use over a long period of time. So in that space, we talk a lot about different types of, again, I'm going to use the word syndrome or diseases. There's also something that's called like alcohol related brain damage. It's kind of like an umbrella term. Mm-hmm. And then there are different kind of sub conditions under that umbrella. So the one that I am most familiar with or have the most hands-on experience with is something called Wernicke-Korsakoff syndrome. It is a type of dementia that's specifically correlated with alcohol, long-term alcohol use, and it occurs because of a vitamin B1 deficiency that is occurring because of, again, that long-term consumption. It presents, at least from my experience, presents very similar to other types of dementias in that we see difficulty with short-term memory, difficulty with potentially visual spatial processing. Potentially, as this progresses or if it gets worse, we can see things with changes in balance, coordination, potentially changes in behavior. Those behaviors can range anywhere from like wandering from the home, resisting getting a shower, repeating aggression, those types of things. So that syndrome, I think, is one of the more talked about from the academic perspective. But there are also other types of dementia that could potentially be correlated with long-term alcohol use as well.
Wow. So just another thing that alcohol leads to.
Yeah.
And in a negative way.
Yeah.
How have you seen, well, okay, before we jump into that, what is something that you wish everyone knew about dementia?
So I feel as though dementia, when I think about dementia globally, so this is like all types of dementia, I think it often does carry a pretty heavy stigma. People are often very afraid of it or avoid it at all costs, which I understand. No one wants to get dementia. But because of that, we see that people prevent telling their doctor about their symptoms and experiences because they don't want to be labeled as having dementia. They don't want to get these cognitive screens done. But early detection is key for getting appropriate resources. There are new medications and treatments available for Alzheimer's disease specifically that only are going to be effective if you're diagnosed early. So I think one thing I would like is to encourage anyone who is experiencing changes in their thinking, or they notice a loved one who has changes in their thinking, to please get a cognitive screen by a medical professional, and at least be comfortable as you can be sharing this with a physician.
Yeah, yeah. Why do we not want to be truthful or open with our doctors? It's almost like ignorance is bliss. Like we don't
Mm-hmm.
want to know. And then we don't want to know, like, okay, well, it's great that now I know the answer, but now I have to do all of this stuff to like
Yeah.
deal with it. And
Yep.
so all those different stages, people just don't want to do.
Yeah. And it like increases potential guilt or fear about the future of, do I lose my independence? Are there negative consequences that come if I get this label slapped on me? And um, I understand all of that, and I don't want to take away from that, but still being able to have those conversations with healthcare providers is still really, really important to being able to access the help that you need.
Yeah, we cannot avoid these difficult conversations,
Mm-hmm.
and because it's procrastinating on our health and
Yes.
well-being.
Yeah.
Yeah.
Very true.
So, how have you seen alcohol play a role in your work as an OT?
Yeah. So I mentioned Wernicke-Korsakoff syndrome. So
Mhm.
I've seen alcohol play out in a few different ways. One is that I've worked with patients who have had dementia as a result of um, long-term alcohol use, that it's been to some degree confirmed that that is the cause of or reason for their dementia. Um, Additionally, I've had patients living with dementia where maybe it hasn't been confirmed that their dementia is directly because of their drinking, but they've had a history of drinking. And so, therefore, now we're trying to manage the person living with dementia, trying to get some form of alcohol when they have this dementia or cognitive impairment. We know that when someone has dementia and they drink on top of it, it makes the dementia symptoms worse. Their cognition, their thinking is going to be more impaired. And so I'll end up working a lot with families on how do we come up with strategies to reduce the agitation, frustration, and persistence of someone attempting to try to get access to alcohol when they have dementia. Because by that point, we can't reason with them. We can't explain to them why they can't have alcohol or why they can't have a glass of wine. So we end up having to use really creative strategies and means to avoid them drinking alcohol without rationalizing with them, because they don't have the capacity to do so.
Oh, this is so okay. This leads me to just a very important question is
Yeah.
what advice would you give those listening who have loved ones with dementia? I mean, a lot of my audience is maybe supporting aging parents in this situation.
Yeah. Oh, I feel like that I could talk for hours on that too, but I think the best thing I can say is um, try to access some form of support. And I realize saying that is so much easier said than done, because where do you even start in looking for support? Which
Well, yeah,
I think,
why don't you just go
yeah.
into the resources, some of the resources
Okay.
that you offer for
Yeah.
dementia, and then that
Perfect.
might open the door for people who need that support and they can start to look.
Thanks, Lindsay. I'd be happy to. So I'm obviously biased. I feel very strongly that occupational therapists who are specifically trained in dementia care are really, really wonderful resource, because they understand the dynamic between how environment impacts us, how activity engagement is so important, and the dynamic between the caregiver and the person living with dementia. So anytime you can access an OT, that's the way to go. I do have the honor of training OTs all across the US and Canada. So on my website, there is a map, a database, so you can try to find an OT in your state or your area who specializes in this work. And then also on my website, I do have some resources, so some free downloads, some low cost downloads. I wrote a little book on activity engagement that you can access there, and then one on one consults and some little like mini courses on specific topics.
I love
You
it.
can also always reach out to me, and if I know of anything or anyone in your direct region, I'll do my best to connect you with them.
Oh. Okay, so they can find you on rachelwileyot.com, but also
But
the
also the
yeah.
dementiacollaborative.com. Yeah, rachelwileyot.com kind of houses like all of my professional things. And then the dementiacollaborative.com is my business website. That's the one that houses the directory and the courses and things like that.
Awesome. We will link that all in the show notes
Thank
as
you,
well.
Lindsay.
Well, this is like your work is so incredibly important. This is an area where people must, I can only imagine, just feel incredibly lost. And
Yeah.
I navigate some support for my mom, and she doesn't even have dementia. She just has a slew of health problems, and this stuff just gets so complicated
Yeah.
that you really need to have an advocate and somebody to help. So,
Yeah.
I love
It
that.
does get really overwhelming. And I think I'm going to end up on like a whole tangent. So please direct me. But I think dementia related behavior, especially, is something that most medications really can't tackle. So, like, if your family member is wandering from the home, if they're repeating, if they're not getting a shower, those aren't things where a doctor can just like prescribe a pill and all of a sudden it's fixed. So, we really do need other healthcare professionals who can help support that doctor in a team to help figure out how do we use non-pharmacologic approaches to help with these things. And there are strategies that can be used. So I think sometimes people just say like, oh, well, they have dementia, of course these things are going to happen. But it doesn't have to be that way.
That's good to know. Okay. Well, okay, we know a lot more about the impact of alcohol on the brain. So we're going to shift gears.
Okay.
I want to venture into something that I think is really important and relevant for the women who are listening to this, and that's caregiving for their loved ones with dementia and the role that alcohol plays in the lives of caregivers. So, caregiver burden, is that something that you speak about?
Yes, that is
Yeah.
a massive concern in this space. So, especially in dementia care. So, statistically, we know that caregivers of older adults with chronic conditions are at an increased risk from their peers for their own health and medical complications and conditions. And then when you layer on dementia specifically, people who care for someone living with dementia have an even higher risk than those caring for other older adults with chronic conditions. So they are at an exceptionally high risk of health and medical complications. And, everyone has a different coping mechanism, healthy or unhealthy. And so we can see that some of those coping mechanisms are often unhealthy and may include things like excessive drinking. Supporting the care partner is really, I know I'm preaching to the choir, but it is a crucial aspect of appropriate dementia care. We often use the term like dyad, meaning that we should be talking about the patient and the person caring for that patient. So we need to be thinking about the two people. The dyad is really the unit who we're treating.
The package.
So, yeah, exactly. So care partners, it's important that the healthcare provider is including you in their treatment plan, but also making sure, again, that you're accessing resources that support you for your mental health. I know, Lindsay, I had kind of touched on this with you earlier, but I think the other tricky part is that even when care providers are including caregivers into their treatment plan, it's important that we also understand the relationship and dynamic of the caregiver and the person living with dementia, because it might not be that the caregiver is turning to alcohol, but it might be that the person living with dementia has turned to alcohol. And so it might be that, like, I worked with a husband and wife one time where the husband had Wernicke-Korsakoff syndrome from excessive drinking. The wife was the primary caregiver. And she said to me, Rachel, I appreciate that you're teaching me strategies to try to get my husband to engage more in activity or not wander from the home. But what you're asking me to do goes against everything I've worked through in therapy to like set my own boundaries and not just go along with what he's saying or thinking. And I can't, in order to maintain my own mental health, I can't do what you're asking me to do. So in that case, the best way I could support both of them was to help them hire a caregiver, someone who could provide the care that he needed in that moment that didn't require her to fall back into old patterns that were unhealthy between the two of them.
You are striking a chord. So my cousin is an occupational therapist, and I remember when we put my grandmother into a nursing home, and she had lived with my uncle she was 98, and my uncle like never moved out, and he lived with her, but he also worked full time. And it was like between my dad going over there to help out and my uncle doing things, it was just like, it is such a strain on the relationship.
Yeah.
Where these are her sons, and she didn't have dementia, by the way. She was 98 and sharp as a tack. She just refused to like drink water because then she would have to get off of her chair and go to the bathroom. You know, it was just like other things. And
that also sounds very familiar in my line of work.
Yeah. Okay, great. So it's like she just wanted to sit and read in her chair all day and not be bothered with eating or whatever. And so when they made that decision to have her put into the nursing home, and she did not want to go, but my cousin, who is an OT, had said, like, now you're going to be able to go there and just like spend time with her. And there's not the stress of like having to come home from work and feed a person and bathe a person. And a lot of people also probably like that sandwich generation, they have children of their own that they have to feed and bathe and do homework and go to soccer and like all of these things. And so like, get the help.
Yes.
Like, or find the resources you have to do the hiring. And I realize that I might be talking about something that is a total luxury for some people, but I'm certain that is part of the resources that you have on your website.
Absolutely. And I think that's also something that I think those of us who care about this work are always trying to figure out from a systems level. How do we try to reduce some of the burden, and how do we get more people access to respite? And so again, I could go on a million tangents that I won't do, but when in doubt, if you don't have the financial resources to tap into your own, whether it be like an adult day program or getting non-medical home caregivers in the home, if that is out of reach, the best place to start is with your area agency on aging. Every single county, at least in the United States, I'm sorry, I'm speaking directly to the US right now, but in the US, area agencies on aging are accessible in every single county. They are the place to go to talk about what financial resources are available to us to help us get some form of respite. Yeah. So yes, respite is essential for anyone doing caregiving. And I really appreciate what you said about like the role shift. Having to be purely caregiver doesn't usually allow us the emotional space to also be a spouse or a partner. And so being able to get additional care can allow us to tap more into those previous roles. I had a caregiver share with me one time that she actually bought herself a pair of scrubs, and she would put her scrubs on when she was in caregiving mode for her own like mental shift. And then she would take her scrubs off. So she was like in caregiving mode with her scrubs on, and then would take her scrubs off, and then she was back in daughter mode, which I thought was really special and really effective.
I'm going to write that one. I'm going to take that one with me. I'm not in this situation right now, but I often tell my dad, I remind him of what we went through with my grandmother. And because he will always say, I'm not going into a home. I'm going to die in my recliner. And I'm like,
a lot of that generation says that, and that might sound good to them, but there's also a lot involved in helping facilitate that. That's a lot easier said than done.
I know. I'm like, remember when Grammy, you're the one who forced her into the home. Right. The shoe's going to be on my foot at some point. Like, I mean, it's easy to joke about it when they're healthy, but when it gets to the time when because the one thing that I really saw with my grandmother is that things would turn a corner quickly when they get older.
Yeah.
And so you don't have a lot of time to prepare once that corner has been turned.
Yeah. It's
It's
so
like,
true.
so
And I think, I didn't get into all of this nitty gritty either. So I talked about like Wernicke-Korsakoff syndrome. Vascular dementia is actually the second most common type of dementia. Um, Vascular dementia is something that people who have long-term alcohol consumption would be at an increased risk for, because it's essentially people who are at higher risk of having like mini strokes or
yes.
like constricted blood vessels, reduced blood flow to the brain for periods of time. That can lead to something like vascular dementia. And again, there are lots of different types of dementia, and everyone kind of presents uniquely and differently. But anecdotally, I will say that vascular dementia presents more as like if someone has a mini stroke, then we see a sharper decline. So it's like we've
Mm.
plateaued, things seem good for a while, and then all of a sudden, sharper decline, and overnight we have all these new care needs that we just have to figure out how to adjust to. And that can be really, really challenging.
Yeah. And so, I mean, something that you just said that is so important is one of the things that I talk about with women who I work with and my audience is just around this idea of like longevity. And this kind of goes into just the current, I think, landscape of like health and wellness and perimenopause and,
Mm-hmm.
being in your late 30s, 40s, 50s is all about just like exercise and protein and being stronger and like, I don't necessarily do my strength training every day just so that I, don't have to buy new clothes and I fit in my clothes. I do it so that when I'm 85, I can live independently.
Mm-hmm.
And if
Mm-hmm.
I end up living to be in my 80s and 90s, I want to be able to do that in a way where I can be as independent as long as possible. And
Absolutely.
like that is what is so important to me. And
Yeah.
I think it is to a lot of the women listening and
That
men.
makes
I
sense.
knew I know I
Yeah.
have a small percentage of men who listen to this
Yeah.
podcast. So
That's great. But I think that's true. I mean, we're definitely seeing trends increase more and more significantly, that most people want to age in place. They want to age in their homes. And there are ways that we can do that effectively. It's just that we have to plan early. So we can't wait until a situation occurs and then all of a sudden we're like, oh shoot, this is going to be really hard for us to manage. I mean, it's possible, but it's more stressful and potentially more expensive.
yeah.
If we plan early, we can age more gracefully for a lot of reasons. One, we can physically do as much within our power to try to protect our bodies and our brains. But also, we can think about our environment as well. Can we set
Yeah.
up our home and environment to be a place where we can safely age, even if we do have some form of disability, which eventually most of us will have some disability. So just kind of being prepared for that, I think, is
Yeah.
important.
Yeah. I mean, isn't aging like you reach your peak and then you start to get back to like when you were a baby? Like,
Yeah, I know. I'm sometimes careful about making these comparisons, because I try to make sure I'm also speaking about people living with dementia with as much respect,
of
because they're
course.
still, adults who have lived a full, meaningful
Yeah.
life. But if we do think about the stages of cognitive decline, so again, without me going into like a whole a whole nerd out, there are different kind of levels within dementia. So we see dementia as progressive, meaning it continues to decline or get worse over time. And those stages can be directly compared to developmental milestones of
Yeah.
babies and toddlers. So yeah, we absolutely do see correlation there. Again, I just say that with
Yeah.
love and compassion in mind.
Well, and not even just on the dementia side, but just our bodily function,
Yeah.
like, bowel movements
Mm-hmm.
and,
Yep.
and speech and, just
Exactly. Well,
like,
that's it. I say like our brains, they control everything in our
yeah.
body. So if we have a brain disease that continues to get worse,
Mm,
every system in our body ends up impacted.
yeah.
So your speech will be impacted, your vision will be impacted, your balance, your coordination, your ability to have a bowel movement, or your continence, your ability to, hold in
Cold. Yeah.
your urine, or your appetite, your ability to swallow, all of these things will end up impacted as dementia progresses.
Right.
Which I know sounds really Debbie Downer. But again, if we think about, I try the best I can when I'm in the dementia care space to focus on, yes, this is a really, can I curse on this podcast?
Yes. Yes.
This is a really shitty situation. Like, I'm not trying to sugarcoat that, but there's also a way to make the best of a really shitty situation. Like, yes, we can still allow this person to live the best quality of life that they are capable of in these crappy circumstances. And I think that I like to think that that is possible. I've still worked with lots of people living with dementia who live very beautiful, fulfilling, meaningful, happy lives. It's just a matter of like the adjustment and how we set it up and how they're supported.
Yeah. Yeah. And how they're supported, people are supported, or
yes,
how their
exactly.
support is supported.
Exactly. That's crucial. If the people who are directly supporting them are feeling supported.
Yeah.
We say that all the time. You know, it's not just conjecture. Like, caregivers who are stressed, the person living with dementia does not function as well. So the better taken care of that caregiver is, the better quality of life the person living with dementia will have. That is research backed. There's no question about that is true. And we also know that a lot of caregivers end up passing away before their family member because of the stress involved in caregiving. I've seen this play out, unfortunately, too many times in my practice. So again, it's why so much of our, especially like current focus in the healthcare world and literature is really focused on how do we support caregivers, because it is a crucial piece of the puzzle and important for everyone's quality of life.
Yeah, yeah. So for the people listening who are saying, oh my gosh, I've been drinking to cope with stress of being in the sandwich generation, maybe, or, caring for my aging parents, what are like two things that they can do to just get better support and take care of themselves? Like, they're burned out / don't know what to do and are scared and are just like kind of tired. What's the first two things they should do?
I know I already mentioned this, but I do feel like this is really important, would be respite. And again, I know that that's a lot easier said than done, but some form of respite, even if the respite means I'm calling my next door neighbor to come sit with my family member living with dementia for 2 hours while I go take a walk and get my nails done. I don't know, whatever it is.
Yeah. Or
just
a nap.
Something. Yeah, exactly. A nap, food, hydration, just basic needs. Although I want to also release the guilt of like, you're also totally allowed to get your nails done. Even if you feel like you're in survival mode, you should be allowed to do that.
Exactly.
So yes, I think respite is a really, really, really important component. And that I'm going to lump in with that, like asking for help. I know, again, that's really hard and we don't always know how and what to ask for. And then, oh gosh, there's so many things that I wish I could ask you to do, but I know that it's all so much. I think 2 would be, let's say, some form of access with the healthcare team. I know that, again, that's easier said than done, but if your family member is already diagnosed and you're already like in the system, if you will, then I would say contact one of those people in the system and ask them to start connecting you with resources. Vermont in particular has this term where they call it like the no wrong door approach, meaning that regardless of how you get into the system should be able to help you figure out how to put the pieces together to support you in your caregiving journey and in that person's journey with dementia. If you haven't yet entered the system, meaning that your family member has cognitive impairment, but they haven't been formally diagnosed with dementia, and so you don't even know where to go. The next best thing you can do, even though it sounds really burdensome, would be set up an appointment with a doctor for them.
Okay.
As soon as you get some form of a diagnosis, That's
Mm,
usually what opens up a lot of the doors to get access to resources. So, for
yeah.
example, like my OT practice, where we used to only work with people with dementia, we had to have a medical diagnosis first before Medicare would cover anything.
Yeah.
So, as burdensome as that may sound, I think ultimately it will hopefully relieve a lot of the long term
Yeah.
burden.
Yeah. Yeah. Oh, thank you. That I think that was really helpful.
Cool.
Now, we're almost out of time, and I just have a couple of more questions
Yeah,
because
please.
I want to just make sure that we close the episode on the actual listener and with alcohol in their lives. And so, as I have more and more experts in the medical space, we continue to just have these discussions about how we have to be our own advocate and
Mm-hmm.
with our own health. And something that a lot of the women who hire me and in my own life, I used to not want to be honest with my doctor about how much I was drinking. And so, um, I try to help people like have conversations with their doctors for their own health. So again, now I'm talking about the person, not as a caregiver.
Okay.
But what are some of the tests or labs that listeners should be tracking and keeping an eye on and requesting from their doctors as it relates to, potential this being an outcome for them later?
That's a great question. So, some of the things that we look at, we want some form of baseline cognitive testing. These are not overly complex. Sometimes you'll hear these acronyms for some of the more common cognitive tests, the MOCA, the Mini Mental or MMSE, the SLUMS. These are some of the more commonly used cognitive tests. I know they don't have the greatest names
Yeah.
attached to them, but I will say more and more primary care physicians are adopting them in regular practice, which is great. So I know, like, I can speak to my parents, for example. I think starting around age 60, their primary care doctors started to embed a cognitive screen. I should say screen and not a test, a
Yeah.
cognitive screen into their wellness checks every year, which is great. So
Yeah.
that's what we want. We want like a baseline, because we also, having baseline also helps us know what is like, quote, normal or typical for that person. So advocating for a cognitive assessment or cognitive screen is great to have some baseline information.
Love it.
If and when, I would say these are things that you don't necessarily need to stress about early. If and when you believe that you have some changes to your thinking, that's when I would advocate for what we call biomarker testing. And so that's some like an MRI and some additional testing that would give us an indication of whether or not you have the biomarkers or biological notes, if you will, that show us that you have like Alzheimer's disease, for example. That's Alzheimer's disease is more advanced in terms of the earlier testing. So again, those are some things we can look at. But I think from a general standpoint, just a simple cognitive screen would be a great place to start.
Okay, that's great. That's simple. I
Yeah.
think we can do this. I
Yes.
think
Not
women,
overly stressful.
yeah, women our age are, I hope, starting to get used to pushing our doctors a little bit
Yes.
more. And if you're not, I want you to. Like,
Yes.
we have to
And
ask.
I think that's so true. I know it's incredibly frustrating. I will, as someone in the healthcare system, I can talk about how infuriating the healthcare system is. But I do think that um, being an advocate for yourself, I can't tell you how many times I have worked with patients who have said to me, I knew something was wrong many, many years ago and said to my doctor, like, something just isn't quite right. And they just swept it under the rug, like, oh, you're going through menopause. Oh, you're stressed. Oh, they kind of brush it off for a lot of different reasons. But the continued advocacy, getting the cognitive test to be able to show something wasn't right, and then being able to advocate for themselves and eventually getting that diagnosis, again, crucial for people who do have Alzheimer's, because now there are medication infusion treatments that can actually treat Alzheimer's disease, which is, unbelievable that we have this available to us, but it only works if we're getting diagnosed in a timely manner. So I
Timely.
appreciate the advocacy efforts. I know how hard it is. And I would also say, I know we're talking to your listeners right now, but I also think advocating for our loved ones as
Yeah.
well.
Yeah.
Sometimes people who have cognitive impairment, the cognitive impairment starts in a part of their brain that houses insight, meaning that for some people with cognitive impairment, they have no insight that they have any thinking issues, meaning that it requires those of us around them to advocate on their behalf because they don't recognize it. So being able to call the doctor ahead of time and saying like, hey, I know they have an appointment with you today. I know you can't tell me anything, but I want you to know I'm noticing changes in their thinking. Please screen them.
Interesting. Okay. Yeah, that is really good. Oh, that's
Sorry
such
to end
good
on
advice.
that.
No, it's also important. And don't worry, I have a question for you that will
Okay,
have us
good.
ending on a happier note, hopefully. I always end the conversation on this podcast with this question. What is something you are doing in your life right now that makes you feel good AF?
I love that question. Lately, it has been spending time with my nieces. So I know Lindsay knows, but my sister lives like less than 10 minutes away from me. She has two under two right now. So I know for her, life is chaotic. But for me as the aunt, I get to just pop in and spend such great time with these two little nuggets. And
Oh.
yeah, it's just such a joy to spend time with them and also to watch my sister um, lean into motherhood. It's been really cool to see.
Oh. Oh, I love that so much. And I'm probably going to be seeing you tomorrow at
Yes,
Hula.
I
But
can't wait.
for the listeners, thank you so much for joining. And we
Thank
will link
you.
Dementia Collaborative in the show notes. Thank you so
Thanks,
much for being
Lindsay.
here.
Thank you so much for having me. I really appreciate it. And hopefully, I know I can ramble, so hopefully, some of what I said makes some sense and really appreciate your time.
Oh, I love it. Thank you so much.
Thanks, Lindsay.